myasthenia gravis is a chronic autoimmune disease, and a short version of etiology will be the fact that neuromuscular junction is affected. So there is no communication between motor neuron and the muscle cell, the innervated muscle cell. It's fairly young people disease. Someone in 20s or 30s can be affected, but again, it may affect anyone of any age. More common in women than men. So as an autoimmune disease, it's caused by antibody-mediated destruction of acetylcholine receptors, and those receptors are located in neuromuscular junction. We don't know the exact mechanism, but it's believed to be related to abnormal T lymphocyte function, and most of the people with myasthenia gravis may present with thymus abnormalities as well. So what are the symptoms of myasthenia gravis? Patients will have less acetylcholine receptors in postsynaptic membrane, and what will happen from each release of acetylcholine from presynaptic membrane will result with lower end plate potential. So what happens, the muscle will be presenting with weakness and fatigue when patient is trying to make a movement or just use that muscle. Most commonly affected, and for one of the first symptoms that will occur, that's extraocular muscles. And I remember from one of my clinical rotation as a student nurse practitioner, we seen the patient who was complaining of diplopia while driving, and the actual cause turned out that it was myasthenia gravis onset, and the gentleman was in his late 50s. And myasthenia gravis may be resulting in sudden exacerbation of symptoms, which may be called myasthenia crisis. So crisis is, when you're thinking about crisis, it's a condition when the ventilation affected, and this may happen after some kind of stress like emotional stress, infection, too much alcohol, or surgical intervention. Also, the treatment is the replenishment of acetylcholine in some way or shape. So the stress may result of the stress will be that acetylcholinesterase drugs are not enough. The patient, or another result will be that, another cause, will be that patient isn't using enough drugs for treatment of this. Diagnosis given based on history and physical examination, but of course patient has to undergo to acetylcholinesterase test and immunoassays, and acetylcholinesterase test will be using tensilon, which is one of the drugs that inhibits actual acetylcholinesterase, and tensilon is actually used for treatment. But what happened when, in this case, you give tensilon to the patient's symptoms are rapidly decreasing and patient is improving, like disease is gone at that point. So positive tensilon test will be diagnostic for myasthenia gravis, but also electrophysiology studies can be done, such as studies that will demonstrate like that muscles do not respond to stimulation of motor nerves. So treatments will be using pharmacological agents. There are two ways to do this, and first is immunosuppressive therapy, and again corticosteroids in this case, as well as medications that may be affecting cholinesterase, such as tensilon. So another treatment is when thymus gland may be completely removed, but it's somewhat controversial treatment because truly the mechanism is not known very well of the disease. So we will have a short overview of mental health disorders, and we'll talk about schizophrenia, mood disorders, and anxiety disorders in this part. Schizophrenia is a type of psychosis, and schizophrenia would be a certain collection of disorder that basically thought disorder. Psychotic individuals may have delusions, hallucination, impaired coping skills, and impaired communication. Swiss psychiatrist Eugene Bleuler used the term schizophrenia first time in 1911, but disease itself was first described and distinguished as a separate mental illness by Dr. Emil Kraepelin in 1887, but at that time the term was dementia precox, and when we read the description of the Emil Kraepelin's, when he describes the symptoms, we can see that these are the symptoms of schizophrenia. Even though we say that disease is recent, like the naming and diagnostic of the disease is recent, but of course through the centuries people had symptoms of schizophrenia, and people had schizophrenia even reviewing ancient sources starting from ancient Egypt. There are descriptions that are very similar to symptoms of schizophrenia. When patients starting experiencing symptoms of schizophrenia, most likely this will happen in relatively early age. It's teenage years to mid-20s, but it's uncommon if patient is having diagnosis of schizophrenia at older time, and if that happens, most likely the disease was undiagnosed earlier. But when patient develops the disease, the one thing comes to mind first, and it's the loss of touch with reality, and the reality is replaced by imagined or fantasy reality. And by fantasy reality, it's not that reality is made up by the patient, but patient truly believes and has. Mood or affective disorders are the disorders that will involve emotions and the outward representation of the emotions. So when we're talking about emotions, we can call it mood, but the representation of the emotions we can call affect. So affective states are brief emotional feelings that are more or less visible and more or less manifested in the patient. Well, you can observe it in the patient, but mood is again a sustained emotional state. Again, common misconception and over-treatment in primary care and even in psychiatric setting, sometimes that not understanding the fact that people may experience times of sadness and times of extreme happiness. So when these emotions are appropriate to the time or to the experiences in life, we do not have a disorders. For instance, someone is grieving because of the loss of a significant other, and at this time we do not have a depression per se. However, if there are emotions not appropriate for the events, or they last inappropriate duration of time, or they are extreme in nature, the mood disorder can be suspected and diagnosed. And again, these are all relative terms in psychiatry, and appropriate or inappropriate, everyone reacts differently. However, the extremes can be diagnostic for mood disorders. And a good example is a manic depressive disorder, or as currently we call it, bipolar disorder, which alternates manic and depressive states. Depression is a prolonged feeling of extreme sadness and unhappiness, despair, discouragement, and we need to learn as healthcare providers to differentiate it from grief, which is realistic sadness related to a loss, to a personal loss. And loss can be a person and an animal, or patient may grieve because of the loss of the function or loss of a limb. But this is expected manifestation. Prolonged grief may become depression, however, if the person isn't able to cope with this, they may experience symptoms of depression. So there are genetic manifestations of genetic background for depression, as well as biological and environmental factors may certainly play a role. In some cases it can be one single factor, in other cases it's multifactorial, but however, nobody truly knows why some people would experience depression and the other may not. But we have some well-established causes for depression, but again, there is no clear picture per se, even though we treat depression relatively well nowadays and we know how to manage it. But again, we don't know exactly how depression occurs. So what are the causes of the depression? Will be, of course, genetic, heredity, personality, and again, personality can be tied to heredity and environment. Situational depression is a different type of depression, and this is a reaction to a situation. However, if the situational depression is, or reaction to the situation is prolonged, this may be cause of situational depression. Medical conditions can affect development of depressions, and for instance, the best example is hypothyroidism. People who develop hypothyroidism very often will develop depression and suicidal thoughts, and the symptoms are completely reversed when the patient is put on levothyroxine or Synthroid, and this is definitely a very strong correlation between hypothyroid state and depression.